Alder glutinosa, commonly known as the black alder. European alder, or common alder, is a deciduous tree in the birch family Beechiaceae. It is native to Europe, North Africa, and parts of Asia, but has also been introduced to other regions for its ecological and ornamental value. Key characteristics: leaves, rounded or ovate, dark green, and sticky, hence glutinosa, with a slightly toothed margin. They turn yellow in autumn before falling. Flowers, monoecious, with male catkins that are long and drooping, and shorter female catkins that develop into woody cone-like fruits. Fruits, small woody cones, strobiles that release winged seed samaras. Growth can reach heights of 20–30 meters. Prefers wet, nutrient-poor soils and often grows near rivers, wetlands, and marshes. Traditional medicine. Bark and leaves have been used in folk medicine for treating wounds, fever, and inflammation. Medicinal applications. Alder glutinosa black alder has several medicinal applications rooted in traditional practices, particularly in Europe. The tree's bark, leaves, and sometimes cones are used for their therapeutic properties due to the presence of bioactive compounds, including tannins, flavonoids, and phenolic acids. Medicinal applications. 1. Anti-inflammatory properties. Traditional use. Bark infusions or decoctions are applied externally to reduce swelling and inflammation. Modern insight. The tannins and phenolic compounds in the bark have anti-inflammatory effects, beneficial for conditions like arthritis or skin inflammation. 2. Wound healing. Traditional use. Poultices made from the bark or leaves are applied to cuts, burns, and ulcers to promote healing. Mechanism. Astringent properties help contract tissues, reduce bleeding, and prevent infection. 3. Fever and flu treatment. Traditional use. Bark decoctions were consumed to lower fevers and alleviate symptoms of colds and flu. Active components. Antipyretic and immune-supporting effects are attributed to bioactive compounds in the bark. 4. Antimicrobial properties. Extracts from the bark and leaves exhibit antibacterial and antifungal properties, effective against minor infections or as a topical antiseptic. 5. Digestive aid. Traditional use. Bark tea was used to treat diarrhea, dysentery, and other gastrointestinal disorders. Mechanism. Tannins act as an astringent, reducing excess fluid secretion in the intestines. 6. Skin conditions. The tree's extracts are used in baths or compresses to alleviate eczema, rashes, and other dermatological issues. Preparation methods. Decoctions. Bark is boiled to extract its medicinal compounds for internal or external use. Infusions. Leaves are steeped in hot water for milder remedies. Poultices. Fresh leaves or ground bark applied directly to wounds or inflamed areas. Tinctures. Alcohol-based extracts of bark are used for long-term storage and internal administration.